PreventConnect is a national project of the California Coalition Against Sexual Assault, sponsored by the U.S. Centers for Disease Control and Prevention. The views and information provided in this web conference do not necessarily represent the official views of the U.S. government, CDC, or CALCASA.
I'm going to turn it over and actually to our Prevention Institute partners, because you have joined us for our web conference From Paid Leave to Rent Stabilization, Research and Practice on Strengthening Economic Security for Violence Prevention. PreventConnect is a national project of the California Coalition Against Sexual Assault, sponsored by the U.S. Centers for Disease Control and Prevention. The views and information provided in this web conference do not necessarily represent the official views of the U.S. government, CDC, or CalCASA. So Alicia and Adina, I want to pass it over to you all. You are our facilitators today, and it is all yours.
Thanks, Ashley. We're excited to be back and having this webinar today on paid leave to rent stabilization. Some of our objectives for the day, I'm just going to move forward here, are to describe the connections between family and community economic security and really talk about their effect on multiple forms of violence with a focus on paid leave for intimate partner violence prevention. We do have quite a few guests today, and so we'll also be touching on housing and its connection to economic security for sexual and domestic violence prevention. We'll be highlighting strategies that communities are operationalizing for prevention, sharing examples from California and Oregon, and really identifying the role that the sexual and domestic violence prevention field has in strengthening economic supports for families. And as always, we like to engage in candid discussions, so please feel free to use the text chat. And let's get into our exciting session today. Abina, do you want to say some hello as well?
Hi everyone, happy to be here.
Abina is going to be sharing a lot of links and resources in the text chat today, so look out for her name for lots of resources that you can access. So to start off, we want to get you using that text chat and ask what economic issues are most pressing in your community that you might want to take action on through a gender-based violence prevention lens. And this is whether you're already engaging in this space or maybe you're new to it. What are some of those large issues that are coming up in your communities? And I'm sure we're going to see a lot of overlap on what people are saying, but we encourage you to start sharing, and we'll come back to see what's coming up. So at Prevention Institute, we like to show our Thrive framework and tool to really talk about how our environments shape our experiences, exposures, behaviors, and how we need to be thinking about our sociocultural environment, our physical built environment, and equitable opportunity. And I like to share this in the beginning just to, set this in a larger landscape of things. So economic security falls within the equitable opportunity cluster here, so the third one at the bottom in green. But, there are overlaps between these different areas. So as even we're talking about things like rent stabilization today, that might fit more into housing, but it really does overlap with this equitable opportunity cluster and economic security. Because, thinking about supply and demand, we can think about things like income and that sort of thing, but we also need to think about how housing affordability can affect our economic stability as well. Oh, I'm just going to move forward the slides here. Okay, so economic security, Okay, I think the slides are going to be showing up for you in a second. They may be a little delayed, but economic security really depends on full access to an equal workforce participation. And looks like our slides are having issues again.
Can someone from the PreventConnect office take over on the slides?
Sure.
Thanks.
Economic security also depends on having comparable salaries across genders and having supports like affordable childcare, paid leave, and medical leave. And we know these things contribute to family stability and a decrease in gender inequality. And this slide that should be showing up for you is drawn from the technical packages from the Centers for Disease Control and Prevention. On the next slide, I wanted to highlight that Prevention Institute actually released a brief earlier this year that talks about the pathways and connections between economic security and safe relationships, and actually gives examples of different strategies across the spectrum of prevention. So talking about strategies in terms of policy, organizational change, all the way down to strengthening individual skills and knowledge. So you can definitely take a look at that piece if you would like more background on this topic. On the next slide, there's just an image here, and it shows the relationship between poverty and intimate partner violence prevention. And I don't think the right slides are showing up on our end, so if the PreventConnect office is advancing them, we're not seeing them advance over here.
Alicia, I'm not touching it because we are having the same issue, so I don't think it's, I think we would just be fighting over going back and forth on the slides. So right now what I see on my screen is our guest from CDC.
Okay. We're currently seeing the economic security slide, but Tori, if you can share the PDF of the slides.
So we've already shared it in the text chat, and I've actually been kicked out of the Adobe Connect room. So if you all scroll up to the top, or I think Obina is going to try to repaste that link sooner in the text chat for you all to see it. So thank you everyone for your patience and understanding.
Okay. So the relationship between poverty and intimate partner violence is really a bidirectional pathway. And the slide that you should be seeing right now, and especially if you're able to click on the link that Abina is sharing, you can definitely take a look at that and see that household poverty and food insecurity is a risk factor for intimate partner violence, and also intimate partner violence is a risk factor for household poverty and food insecurity as well. So it's really this bidirectional relationship. Looking back at the text chat, it seems like folks have been talking about things like housing, affordable housing, child care, things like transportation and how that affects economic stability, public assistance programs. It seems like transportation has come up a few times, which is one that people don't always mention right away, so I appreciate that we're thinking about that. The wage gap, living wages, opposing predatory lending, that one's really interesting, definitely. So yeah, lots of different economic issues that we can be centering on. Today we're going to be starting off with moving into talking about paid leave a little bit, and we're lucky enough to have guests from the Centers for Disease Control and Prevention. Megan and Ashley, can you just say a quick hello so we can make sure you're still there?
Hi Alicia, this is Megan, and this is Ashley. Can you hear us okay?
We can hear you, great. So Megan Kearns and Ashley D'Inverno are both behavioral scientists in the Division of Violence Prevention at the Centers for Disease Control and Prevention. Megan supports multiple CDC-funded research and evaluation projects focused on the prevention of intimate partner violence and sexual violence. She has over 30 publications on violence and trauma-related research, including the Preventing Intimate Partner Violence technical package. Ashley has done work examining public policies as a primary prevention tool for intimate partner violence, sexual violence, and teen dating violence. She also worked on surveillance systems that measure and monitor trends in intimate partner violence and sexual violence, including the National Intimate Partner Violence and Sexual Violence Survey, NISPIS, and BioSense, a syndromic surveillance system. Ashley's current role involves supporting the National Centers of Excellence in Youth Violence Prevention. So Ashley and Megan, how has the CDC been thinking about the connections between economic supports and violence prevention? And more specifically, why did you decide to research the connections between partner violence and paid family leave?
Those are all great questions, Alicia. And I guess I'll just start by saying that at the Division of Violence Prevention at CDC, we've really put an emphasis on trying to identify innovative prevention strategies, especially ones that can have potential for cross-cutting impacts on multiple forms of violence, since we know they're so interconnected. And then when it comes to policy, there really have been a lot of notable public health achievements that have involved policy-based prevention approaches. So, for example, seatbelt laws for reducing motor vehicle injuries or smoke-free workplace policies. Policies have a lot of potential because they can impact large segments of the population and change risk and protective factors at the community and societal level. So when thinking about policies that are relevant to violence prevention, there's really a number of opportunities to work with diverse sectors, from education to economic to criminal justice, and really starting to think strategically about what policies within those sectors would have potential to prevent violence. And I'm going to try to advance the slides and see what happens. Okay, it worked. So one of the strategies that we identified in our technical package for preventing intimate partner violence included strengthening economic supports for families, because we know, as you mentioned earlier, that economic factors are associated with risk for multiple forms of violence. So some of the approaches that we identified in that package include strengthening household financial security, strengthening work-family supports, and providing opportunities to empower girls and women. Based on the best available evidence outlined in our technical packages, some of the potential outcomes are those listed on this slide, and I won't read through those because I know we've got a packed agenda today, but paid parental leave is one of the example policies that's described in the technical package as a way to strengthen economic supports for families. And I'm going to let Ashley say more about the research on paid parental leave.
So yeah, we definitely love to hear more about the research and specifically the mechanisms by which paid leave might support safe relationships.
Yes, so this is Ashley. Paid parental leave supports new parents by providing job-protected paid time off to bond and care for a new child. And I'd like to note here that I'm saying paid parental leave because I'm talking about time off for new mothers and new fathers. And there's been a number of reported health benefits of paid leave for mothers and fathers. So for mothers, it's been associated with reduced psychological distress, lower levels of depression, and greater physical well-being. And for fathers, it's been linked to increased physical activity, more health-promoting attitudes and behaviors, and also a decreased risk of mortality. So providing job-protected paid time off, paid parental leave, has the potential to strengthen economic support, reduce family discord, and also provide opportunities to empower women, and all of which may reduce exposure to risk factors for intimate partner violence and promote protective factors. So what does paid leave look like in the U.S.? Currently, unfortunately, at the federal level, we don't have paid leave. Instead, we have FMLA, which provides workers with 12 weeks of unpaid leave. But in order to be eligible for FMLA leave, an employee must have worked at least 1,250 hours in the past year, been at the company for at least a year, and be employed by a company with at least 50 or more employees. So because of exemptions like these, FMLA only covers 60% of American workers and less than 1/5 of new moms. And the U.S. is the only industrialized nation without paid maternity leave. Most countries also offer some form of paid paternity leave. But thankfully, some states have started to offer paid leave. So we have about 8 states and Washington, D.C., as well as a number of cities that have adopted their own policies. So in caring for a new child, which does include adoption, some states also allow their workers to use this time off to care for a seriously ill family member, to recover from a health condition, or to deal with family obligations. And finally, organizations are free to offer their own paid leave policies, and many private companies do this. And I also wanted to point out on the right-hand column that all of these policies have maximum weekly wage replacement rates. So employees are still not being paid 100% of their salaries. So we propose 3 processes or mechanisms of change through which paid parental leave may potentially prevent or reduce IPV, and these pathways include ways in which paid leave may serve as a primary, secondary, or tertiary prevention strategy. And I know that that's an overwhelming theory of change model, but I'm going to break it down for you right now. So in this first pathway, paid parental leave would maintain household income, thereby preventing financial stressors and associated relationship discord that can provoke instances of relationship violence. So this pathway is really about reducing financial stress and worry that can serve as a precursor to violence. So research shows that poverty and financial stress are risk factors for IPV. So being unsure about where your next meal is going to come from, or having to worry about whether you will be evicted or how you will pay your utilities, can create stress and worry that's linked to IPV. And there was a qualitative study of women who experienced IPV during or shortly after giving birth, and they found that IPV often existed in conjunction with other stressful life events, such as financial and housing difficulties. And finally, there was an Australian study that found that women who worked during pregnancy and qualified for paid maternity leave recorded about 58% lower odds of IPV in the first 12 months postpartum compared to those women that did not have access to paid maternity leave. In the next path, we anticipate that paid parental leave will encourage fathers to become more involved and participate in child care duties, which would then decrease the stigma of men who are participating in domestic work and taking parental leave, and improve attitudes and beliefs about women as equals. It would also reduce work interruptions for mothers, which could impact future earning potential. It could increase the likelihood of returning to work postpartum, and also provide support for mothers' career advancement. And together, these experiences and outcomes would increase egalitarian parenting practices and domestic work, and also reduce traditional gender roles, which would ultimately increase gender equity and reduce or prevent IPV. So as I mentioned in path 2, we believe that paid parental leave will increase egalitarian parenting practices and decrease the impact of work interruptions on women's advancement in the workplace, thereby increasing gender equity and lowering the rates of IPV against women. So at the individual level, we know that endorsement of patriarchal gender role attitudes has been linked to physical and sexual violence against an intimate partner. And at the societal level, we have indices of gender inequality that have been strongly linked to rates of girls' physical dating violence victimization. And we also know if we get fathers involved in physical and emotional care of children, which paid leave would allow them to do, they're more likely to hold gender equitable attitudes. In the U.S., working mothers spend approximately twice as much time as working fathers engaged in domestic work, and this difference is due largely to child care duties. So evidence suggests that policies that provide and encourage fathers paid leave increase their participation in these child care duties, and fathers who participate early in child care tend to stay involved throughout a child's life. We also hope that as fathers' use of parental leave becomes more common, the stigma of assisting with child care would subside and aid in changing traditional masculine ideologies that have been associated with gender inequality and IPV against women. And finally, one source of gender inequality relates to the wage gap between male and female workers. So we know that the median weekly earnings for women in the U.S. represent about 82% of the weekly earnings for men in 2016. And research also shows that the gender wage gap is even more pronounced for women who have children. Working mothers in the U.S. experience a 4 to 7% wage penalty per child, and that's largely accounted for by work interruptions for child care, changes in employer at reentry into the labor market, and other economic responses to motherhood. So paid leave supports mothers in returning to work following the birth of a child, and women are more likely to return to their previous employer after birth and experience positive wage benefits, which would advance gender equality in the long term. And then the final pathway, paid parental leave, facilitates parental involvement, which would lead to breastfeeding, preoccupation with the infant, knowledge and interest in infant development, which in turn improves maternal, paternal, and child physical and mental health. It reduces the risk of negative parenting practices and increases exposure to parental protective factors, which would aid in preventing and witnessing IPV and victimization and child maltreatment, as well as perpetration of teen dating violence and antisocial behavior, which we know are precursors to IPV. So research has shown that paid leave encourages interest in child development. It increases involvement in child caretaking responsibilities. It also offers opportunity to become more attentive to an infant's needs, and it increases the probability and duration of exclusive breastfeeding. So in turn, these parenting behaviors contribute to decreasing the risk of externalizing disorders, depression, substance use, and risky sexual behavior, which we know are risk factors for teen dating violence. It also promotes longer duration of breastfeeding, which can be influenced by paid leave, and has been linked to lower risk for child abuse and neglect. And finally, it interrupts the intergenerational transmission of IPV. So if paid parental leave prevents a child from being a victim of child maltreatment or a witness to IPV, then the intergenerational transmission of IPV will also be interrupted, since these forms of family violence are also predictors of IPV.
Thanks for detangling those pathways. Would love for you to share a little bit about, based on the research you did, what are some of the remaining questions and future directions?
Yeah, so there's been some limitations with this work, and the first is that there could be some unintended consequences. We really need to find out what is the ideal length of paid leave. Too much paid leave or too much leave could be harmful to a woman's career in the form of lower wages, lower labor market attachment, and workplace discrimination. So there's some evidence that suggests that even short-term interruptions from work can increase a woman's risk for downward mobility and decrease her chances for upward mobility. So we really need to find out what is that minimum amount of time necessary to achieve the positive outcome related to paid leave, but without harming career advancement. We also need more research conducted domestically. The majority of evaluations and research examining the outcomes associated with paid leave have been conducted internationally. And we know that policies may produce different results in the U.S. relative to other countries. So it's important that these policies are adapted to fit the culture of the people that are affected. We also have a really limited understanding of how paid leave impacts people of differing statuses, marital status, sexual orientation, race, SES, and different job roles. And finally, we need more research and data sources to examine high-risk subpopulations and also how paid leave impacts risk and protective factors that might overlap with other forms of violence, so that we know if this policy also has the potential to prevent other forms of violence as well.
Thank you for that. There's been some great engagement in the text chat, someone saying thank you for this great presentation. And we also had another comment around how this is intersecting with harmful norms around masculinity and femininity. And I think that's really interesting to pull out, showing the interrelationship between different risk factors. So in this, we're really talking a lot about gender inequities and how to decrease them through how paid family leave can help support some of that, as well as the pathways of decreasing household poverty and financial stress. So I think that's really interesting. For time's sake, I think we're going to keep moving on, but it's really great that Megan and Ashley were able to share more about the paid leave work, and you can definitely look at their research some more, and we'll bring them back at the end. They've also been looking at things like science, technology, engineering, and math programs, and thinking about other types of economic supports too. So thank you so much, Ashley and Megan, for sharing.
Thank you.
Sure, thanks for having us.
So we're going to go to our next guests today that are based in California, and we're really excited to have both Alejandra and Genya here, who are focusing on paid leave. So it's a great build-off from the research that was just shared. Alejandra is Mexican-American, formerly undocumented, and leading the statewide prevention program at the Partnership to End Domestic Violence, really focused on strengthening prevention efforts across California. She holds 15-plus years of diverse experience working with survivors of intimate partner violence and sexual violence. Throughout her work, Alejandra has used her voice to speak up about the relationship between abuse and prevention, the interconnectedness of all social justice efforts, and the diversity of lived experiences, recognizing that there is no one-size-fits-all strategy for prevention or intervention. Alejandra values the importance of working together to promote collective strength and stands in solidarity with our communities. We also have Genya Cassidy, who is the director of the California Work and Family Coalition, a statewide alliance of parents, caregivers, and advocates organizing to realize equitable, family-friendly workplaces and to expand the social safety net in California. Before leading the coalition, Genya was the California Policy Director for the Labor Project for Working Families, a union representative for SEIU, Local 250, and a community organizer in New York. Hi, Genya and Alejandra. Do you want to just say a quick hello, make sure your sound's working?
Hi.
Hola.
Hola, hello. Genya, can you start off by telling us a little bit about the California Work and Family Coalition?
Yeah, thank you. I'd be happy to. So the California Work and Family Coalition we're a statewide alliance of organizations and individuals, and we've been, since 2002, united around the goal of really winning the right to take time to care for ourselves and care for each other, which we consider kind of a basic right. We led the campaign to win the first paid family leave law, to win it in California, which was the first law in the country, and that really sparked a movement around the country because, as we heard a little bit earlier, we don't have a federal law. The United States is way behind other countries, and it used to be common knowledge that we would never be able to pass a law like this in the U.S. So it really created a lot of hope and excitement when California passed this law. Since then, 8 states, and that includes Washington, D.C., have paid leave laws. We also are part of a network of 27 state coalitions that have campaigns right now. And for the first time, really, there's great momentum at the federal level. So as a coalition, one thing I want to say that we'll talk about more later is that we've just learned a lot of lessons since 2002 when we passed the first law. And, really passing the law for us was just the first step. We really learned along the way that paid leave was working really well for the families that took it. As we heard earlier, breastfeeding rates, the median rate doubled, more men taking leave, more fathers. But at the same time, there are barriers, and it's not working equally for everybody. We found from early studies that new immigrants, low-wage workers, and young families were much less likely to even know about the benefits. So that's the first hurdle that we've had to work on, is raising awareness Also, as we also heard, the FMLA doesn't cover everybody, and our state laws don't, so we needed to work on job protection. You shouldn't be fired for using a benefit that you pay into or risk being fired. That obviously would make the law inequitable for people. So another important lesson, just the last one I'll share about our coalition, is that coalition building as a strategy has been really important for us because we really need all of the diverse communities and perspectives at the table whether we're crafting a new law or talking about how to make our law work better. We just need all those voices. There's a lot of excitement right now with the new governor, and one of the exciting things for me is having this partnership with Alejandra and being part of the prevention of IPV world, because it kind of puts a whole new tool in the constellation we're working in, that we're really looking at just how key paid leave is to health and well-being for everybody.
Thanks for that overview. I think that, you know, a lot of people think about passing the policy and how to go about that, but you're all bringing really important perspectives that even once paid leave passes, we still need to be thinking about implementation and thinking about who has access to that leave and what are the inequities that still exist. For those of you in communities that don't have paid leave yet, I think there's important learnings here for you too, and even thinking about how to frame this issue and make sure that paid leave can be as accessible as possible. So Alejandra, as a preventionist, how did you land on working on economic security, and how did you and Jenya start working together?
Thanks, Alicia, and thanks everyone for inviting us to join this web conference. Some of you who know me know that I'm a child of domestic violence. My mother had several reasons to not leave my father, but as she shared, as we're going through also our mother-daughter healing process, she shared that, you know, how would she leave her husband when he was the one who managed everything, all the finances, all the bills? She didn't have a bank account. She, as she shares, you know, she would not have been able to manage anything without him. So in our conversations with Jenya, I've shared the waterfall analogy, and she's really appreciated it, because the way I see prevention, in most cases, if there's a waterfall and people are drowning, intervention staff tend to go to the bottom to help people out, get them access to resources, and preventionists go to the top and around the waterfall to really understand the why and help prevent it from happening again. So from our research around this waterfall, we've learned that a lack of economic security is one of the primary risk factors of IPV. So in working with Jenya and the Work and Family Coalition, we're really focusing on helping raise access to and awareness of paid leave, and this just seems to fit perfectly into our work. The problem is I'd never worked on such a project, so I was out of my element here, or so I thought. Because I definitely don't know all the facts about paid leave. So I definitely had to take the lead from Jenya and other members of the Work and Family Coalition to learn about paid leave. But I do know about financial dependence. I do know about the lack of access to resources. And I'm pretty good at connecting with folks. So this has helped me build and sustain some of these partnerships that have guided us through this effort. In the picture on the slide, this is my beautiful mommy at the Capitol. She joined me for this rally for janitorial staff and their lack of access to safe workspaces and job protection. Before you know it, my mom was talking to some of the janitors, and as I glanced over and joined some of their conversations, they were discussing how they felt powerless at home in their relationships and powerless at work. This is not okay. And to hear them bond across so many of these intersections, I knew that we were at the right place. This experience, and in most of the paid leave trainings that Jenya has invited me to, we've been able to hear about the lack of access to the knowledge and the resources, especially for immigrants and low-wage earners. Whether it be due to a lack of access because of a language barrier, fear for asking information, or believing that paid leave is a handout, there are several folks who need but don't use paid leave. This has to change, and that is the mission of our project. We recognize that while our focus is on paid leave, we're also building connections in an effort to respond to the needs of the community, recognizing that we don't need to do it alone. Because there's so many other fantastic partners that are already doing this work. And Jenya has done a beautiful job of taking me out to meet other partners like the Parent Voices of California, and working with them, aligning our efforts, and always bringing in, trickling in the aspect of healthier relationships at home and in the workplace. How did our relationship form? Jenya and I were just talking about that. Do you remember how we were preparing for the statewide meeting?
Yeah. So we have an annual meeting that is where we make our big plans for the coming year, and Alejandra was in town with her mom and was able and available to help, so we had a collating pizza party at my apartment the night before. And that's important because it actually made me feel comfortable. We had, staff, my kids, Alejandra's mom. It was a whole group thing. And I think experiences like that made it comfortable for me then to just invite Alejandra to come join me when we were meeting with Parent Voices, farm workers in Fresno that had issues with their paid family leave. So that was great.
So our takeaway was that prevention and coalition building doesn't happen just from 9 to 5.
Yeah, thank you for sharing those personal stories and your lived experiences as well. Can you share a little bit more about the data and stories that really showcase this issue of access that you've started to talk about?
Yeah, this is Jenya. I can share a little bit more. One of the things that came out to me is I want to share a story of a pregnancy and new parenting on my part, but part of it is how paid leave really impacts whole families. And more, I'm really encouraging coalition members and all of our partners to really talk about it as paid family leave, not focusing in on paid parental leave as a separate issue. Because as we see more and more, it really impacts whole families when even one family member is also available for caregiving. Even in the same year somebody has a new child. So when I was pregnant with my twins, it was my second pregnancy, and it was a very different pregnancy. And I was finally kind of getting into the swing of things, and then was diagnosed with this fairly rare condition called twin-to-twin transfusion syndrome. It only affects a really small percentage of identical twin pregnancies, which are already rare to begin with. And it can be, often ends in fatality either in utero or right after birth of one or both twins, and can lead to a lot of other things. So intervention right away is necessary. So I went to this appointment really still in my mind thinking I would maybe take off 4 weeks before my twin due date, like in a normal pregnancy you would, and then being put on bed rest at 15 weeks pregnant, which was a really hard thing, and it was a kind of a mournful time because there wasn't a high percentage of chance that the twins would be born healthy. And it was a time when I was really needing not yet paid parental leave to bond with my children, but actually pregnancy disability leave to even help make sure they were born. And I had such incredible support from friends, coworkers, my then partner, husband, and other family members. It was really a caregiving as well as, awaiting new children. I really credit the twins being born healthy, albeit a little bit premature, but definitely healthy. They just started high school last week, and they're doing great. And I really credit that time that could have been and was in some ways so very stressful with a lot of the supports that my family and friends had and that I had, including even a very supportive boss, but it didn't hurt, frankly, to have a union contract that spelled out exactly what my leave would look like. And, I think that, to me, shows that it's really parenting, caregiving, all of those things. And what I want to share now is a little bit more on, what we're seeing happening around the state, though. So I had this great supportive thing where even my coworker was able to take off work and take me to the hospital twice. We really need to expand this to more family members and have more people be able to take leave. But one of the first barriers, as I said before, is the low awareness of the program. We found out pretty early on that lowness was where, awareness was low. And we did a study, we paid for a field poll a few years ago that showed that it was less than half of California registered voters actually knew about paid leave, 42.7%. It was a much lower amount when you look at people who self-identified as new immigrants was in the 25% range. Then we look at LA, which is has always been one of the target areas, 31% of awareness. Obviously, If people don't know about the program, they can't use it. Then after that, as we talked about earlier, FMLA, job protection, does not cover everybody. Our paid leave law does not come with its own protection. It's a benefit, not a right. So we need to expand that right to job protection. If 40% of workers are left out of that, that's a huge barrier for people that they could be fired. The other thing is, obviously, if you're a low-wage worker close to making minimum wage, the wage replacement rate might not be enough for you. We did see from a Senate report that came out a few years ago, people making $80,000 plus, leave taking was going up. For other people making much less than that, it was actually even going down from where it was in the first few years. So these are all things that have helped us look at what we really need to do and what we need to change, including things like, that might seem like smaller things, working with the Employment Development Department that administers the program to make sure that the application process works for everybody, looking at Lyft drivers, people who are contractors, whether they're misclassified or actually contractors, that it's an easy, seamless thing for them to pay into SDI, just making it accessible for everybody.
Thanks, Jenya. I think there's a lot of appreciation, coming up so far in the text chat around the reframe that you're providing, that paid leave is really about, having this values-driven human right and how much it benefits society as a whole, and a lot of appreciation for the work that your two coalitions are doing. So understanding, I think you've done a really great job of illuminating this issue of access, both through data and through your personal story. What sort of actions are your two coalitions taking together? And I know you're working with other partners as well.
So this is Jenya, and then Alejandro will talk more about some of the things that we're all doing together. So for the coalition, our main focus is policy, changing laws, implementation, which for us can also mean things like working with the EDD. We're at a table with them on how to just make things like the application process better. Doing community education so that we have a lot more paid leave trainers and points of entry where people can learn about the program. And then the coalition building is important because we need to keep staying on our law to make sure it's really working for everybody, and we need to keep going back and changing policy. That coalition building piece and also the policy change this year will look like a lot more work directly in the districts, because we really need to build leadership at the district level. One of the strengths of having a statewide coalition is that we're not just in the capital. We really do have more of our strength in some of the districts, and we want to build that up so that we can educate our legislators that really need to learn why this is just a very basic human right and not, some special weird thing. So we're working with constituents to work with them on how to educate their districts and how to build that up. Then we also have we're building some communities like the Paid Family Leave Work Group that is working on making some of that education that we're doing something that the EDD maybe can collaborate with us on. So that's the accessible community training piece that Alejandro can talk about more, because I feel like this year in this partnership we're going to be expanding that.
So originally, when we started talking about next steps and what we were going to do, we thought we'd develop a training manual for staff from domestic violence and non-DV orgs to lead trainings on paid leave. But through conversations and really listening to the needs of the community, we have now decided it's going to be a bit more of a paid leave toolkit with resources for preventionists, advocates, organizers, promotoras, anyone really to lead either a more structured 30 to 60-minute presentation or a 5 to 15-minute chat with community members. It really depends on the scenario or the situation. In this toolkit, we're also going to be including scenarios, activities, surveys, and handouts. So if you are at the bus stop and someone is talking about the stress of needing to take time off to care for a loved one, boom, there's a resource for that. So we're trying to think of different avenues for people to engage in conversations with others. And thank you, Danielle, for your comment around the barriers, and that's actually one of the things that we're wanting to bring in. So we want to develop scenarios that address and help shift this narrative on accessing paid leave. making sure that we are using gender-neutral language, that we are thinking about the diverse relationships that exist in our state, that we are trying to reach those who feel that paid leave is not for them. So in an effort to be more responsive and community-centered, we're forming a community of practice that's focused on paid leave, where members from DV orgs, rape crisis centers, and other members of the Work and Family Coalition are going to be able to join to review this toolkit, identify any gaps. They're really going to pilot test this toolkit and help us figure out how to go about using it and distributing it among other organizations. We want to provide them with as many resources as possible so that they can see how to build partner opportunities to work with DV-SV orgs, local public health departments, healthcare workers, care providers, and other diverse partners to learn about paid leave and managing economic stress. Yeah, so it's a really exciting opportunity for us. We're really looking forward to leveraging also our prevention efforts, recognizing that we can't do this alone and shouldn't be. So in California, we are bridging the gap between 3 state action plans. One is the rape prevention education with CalCASA, the Essentials for Childhood with the California Department of Public Health, and the IPV Prevention State Action Plan, which is Delta Impact with us, the partnership. So we're working together across all these plans to help lift up information about access to economic security and resources.
That's great. Yeah, and I think what you've been speaking to really reinforces that it's both the policy and the norms and culture change that needs to be happening, and I think these activities help support some of that norms and culture change as well. That can be sometimes harder, just as hard or harder to make change in to support paid leave. So we want to have another text chat question here and ask all of you, thinking about some of these actions that Alejandra specifically just shared, how would you justify the development of tools or this toolkit that solely focuses on economic security and doesn't actually mention healthy relationships or domestic violence, sexual violence prevention? So we would love to hear from you. If you're focusing on other kind of community determinants too, how are you making that case if it feels a little bit more distal maybe? And at the same time, while folks are text chatting there, I want to ask the same question to you, Alejandra. How do you justify, as someone who works at the California Partnership to End Domestic Violence, how do you justify the creation of these tools? And also, what kind of roles do you see the field playing in this type of work?
Thanks for the question. I love this. I think as I shared at the beginning, this was a bit of a challenge for me into how do we do this, because I think as preventionists we tend to focus on curriculum-based projects and items that focus on working in schools, community settings, something that's a little more guided. And in this project, we're really figuring it out as we go along. So constantly having to check in, Jenya and I, on what are we doing, where are we going, what is our focus area. I know the CDC folks are on here. We've got some scopes that we need to meet. We have to think about where do we want to be in 5 years. And honestly, sometimes we're not sure because things change on a daily basis or on a legislative process basis. So what is our role? Our role, I think for us, it's really been forgetting about the box, just really stepping outside and putting it aside, leaning into the community, listening to the needs, focusing on those skills that we have as preventionists. We are educators, we're outreach workers, we are organizers, bringing that into the conversation, being able to have fun together. You have some of these pictures here where Jenya and I have been working on collating our presentation materials, and we have these awesome conversations about the lack of access that people have, and then we have these amazing ideas of, we need to do this. Now we're going to Fresno. We need to go to LA and do these trainings together with DV orgs and non-DV orgs. Yes. the toolkit needs to bring in some scenarios that talk about, immigrants not having access to, or a daughter talking to their father about why they won't access these benefits. Yes. So it's just engaging in conversations with each other. I will say that we do bring in the skills of healthy relationships and communication into our relationship, Jenya and I. We have conversations about, is this working for you? How can we make our relationship better? We've talked about we're almost like dating because we have to have genuine and honest conversations about is my communication style working for you? Am I helping you where you need it the most? Where should I be? So we were at an LA training, and I felt that it made sense for me to be helping serve the breakfast because I could talk to people and ask them, what brings you here and what's going on and where do you work and what do you do? So get involved, offer to help, and really, again, I think I got to reinforce the thinking outside the box when it comes to prevention, letting go of that curriculum-based approach and just leaning in to each other.
That's great. I'd love to hear what's coming up in the text chat. Seems like we've been seeing a lot. Tori, do you want to start us off?
Sure. Thanks, Alicia. So I saw a couple people talk about the way that they would connect domestic violence or sexual violence prevention and economic security would be by doing exactly what you all have done already in this web conference, by explaining the logic of it, making those connections, and showing that logic model from the research from our CDC guests. So thank you for sharing that. Colleen also made a really great point about promoting economic security reduces both vulnerability to victimization and motivation for perpetration of multiple forms of violence. So thank you, Colleen, for pointing that out. And Ashley had chimed in on the text chat, too, that we are still modeling healthy relationship skills, or at least Alejandra and Jenya are modeling that for the rest of us as well. So, Alicia, did you have anything that you wanted to add?
I feel like you got the gist of it right there. Yeah, and I think that having some of the research that Ashley and Megan shared in the beginning is helpful, and then just thinking about the data as well as the stories. I've really enjoyed how Alejandra and Jenya have brought in the storytelling aspect of things too, which can be really important in building the case too. I think the logic models and the numbers are really important, and also, what is the community saying? What are people locally saying the issues are when it comes to having safe relationships? So yeah, that's kind of what's coming up for me too. So before we go on to our last guest, I know we have a packed agenda today, as we said before. Would love to hear from our California team right now. What are some of the challenges that have been arising? And I know that you're real problem solvers, so how are you overcoming those challenges too?
Yeah, this is Jenya. So I think we've had we've had a lot of years of working on policy around this issue, and one of the biggest challenges we have at the policy level is, frankly, job protection. And it probably is surprising for people outside of this work because it's a very invisible thing. When you have job protection, it's like this invisible right, a cloak of, invisible job protection that you have, but it's so cute. FMLA I don't see anymore as unpaid leave. I see it as job protection, and we really need to expand it to more people. But there's opposition to it because a long time ago, employers kind of realized, well, the money is not our money, so fine if people have that. But if they have the right to take leave, we've had employers come to the Capitol and say, we want to be able to say no. And that obviously is not equitable. And it's actually a lot more low-wage workers that do not take leave because of job protection. We hear that even more, at least anecdotally, than the wage replacement levels. And I think in New York, part of why they had a good first year of leave is that they not only had job protection for every size employer, that they also had a pretty robust education campaign. It is something we expanded recently to more new parents for 20 or more. But that's the other issue, is that we have this great, amazing new governor that loves paid leave and really is an advocate for it himself, hired some of the most amazing brains in this work, people that were there when paid leave passed in California at the beginning. And the focus, though, is very much on new parents, because that's the beginning of life. That's what we all see. But we really need, as a coalition, to make sure that we're really looking at not only caregivers, but really diverse families. And we even include chosen family or family not by blood in that, really trying to say at the federal and every state level it needs to be that diverse. The last thing is obviously with new immigrants that we talked earlier about some of the challenges there, but we need special protections for undocumented workers who pay into the program and need a little bit more protection and a reassurance that there will be no negative anything, because applying for government, anything right now that's related can be a little bit more scary. So those are some of the challenges. The last one is, of course, we're a really diverse coalition, and just like Alejandro said, we really have to learn to listen to each other and have that respect of where everybody's coming from, because it is, I use dating analogies a lot. It is like getting to know and connect and really kind of vibe with people that you never even thought you would be, knowing in your life, and now we're all together working on this goal that really impacts everyone.
Lastly, I think it's funds. We lack funds to make trainings and outreach materials accessible to marginalized groups. It is very expensive to have interpretation and translation at every event and training, so making sure that we have access to that. Evaluation is tough when we're working out in the community. When we have large events, we're doing some outreach programming. So really thinking outside the box when it comes to this evaluation, and then working with diverse partners. So we're working with our evaluator, Pat. She's on the web conference right now. Pat is helping us develop some partner tracking tools that measure some of this engagement and how we can improve as partners to really hear each other and support each other's projects. And then lastly, I think it's just for us, the response to these challenges is to focus on the protective factors. As many of you have mentioned, if we can focus on economic security and access to financial independence, then we are doing the work around prevention. We are taking on this effort. It's really an outside-of-the-box way of thinking for us, but it makes perfect sense. It's the #1 reason why people don't leave unhealthy relationships. So if we focus back on the waterfall analogy, we got this.
Thank you. That's great, and left us feeling very hopeful. So we're going to go to our next guest. We're going to go north to Oregon from California, and we'll come back to Alejandro and Jenny at the end. Thank you so much for sharing. If folks do have questions for them, you can maybe start some chats in the text chat, and maybe Alejandro and Jenny, if you can respond to anything, that would be great too. Our next guest is looking at economic stability through housing, which is an area that I know we haven't talked about as much. Sybil Hebb is the Director of Legislative Advocacy at the Oregon Law Center, a statewide law firm whose mission is to ensure access to justice for low-income Oregonians. Is that how you say it? She worked as a lawyer representing survivors of domestic and sexual violence in family law, protection order, housing, and employment matters for 10 years before moving into legislative policy advocacy. She is committed to ensuring that policy discussions incorporate the voices and perspectives of survivors and advocates. Hi, Sybil.
Great to be here. Thanks so much for having me.
Thanks for joining us. So in Oregon, I know you recently had a very successful passing of a bill that supports housing stability. Congratulations on that. Can you give people some of the quick facts about what the legislation does and why it's important?
Thank you so much, and I just want to appreciate all of the fantastic work that's been done by all of you, and particularly the fabulous information about paid family leave. So really, really appreciate that. And before I want to get started, I just wanted to do a quick shout out to Michelle Roland Schwartz from our Oregon Attorney General Sexual Assault Task Force, who was really sorry not to be able to be here today due to a conflict. But I'm really excited to talk about the bill that just passed in Oregon. It's called Senate Bill 608, and it was brought forward really to address just the huge housing stability concerns that were felt and are continuing to be felt by the 40% of Oregon households who rent their homes. And prior to passage of this law, there was nothing prohibiting or preventing Oregon landlords from raising rents as high as they wanted, as many times as they wanted, or evicting people at any time without stating a reason, even if tenants had always been paying their rent on time and following all the rules. And so we were seeing just mass displacement and, rent increases of 30%, 40%, even 100% or more with little notice, which really serves as the functional equivalent of eviction. And so people were being thrust into major crisis at a time when the National Low-Income Housing Coalition has just found, and we saw that locally as well, that there is no county in the country right now where a single minimum wage earner can afford the local prevailing cost of a two-bedroom home. So when families were getting eviction notices or were getting huge rent increases, they were unable to find alternative housing within the notice period, and they were really very much at risk of homelessness. And so that created incredible pressures in the marketplace and caused people just to be really vulnerable. And in addition to that basic economic vulnerability, what we found was that the market was so favorable to landlords and property managers that it was facilitating bad actors misusing laws in ways that were discriminatory or retaliatory, and those practices were having a specific impact, particularly, of course, on low-income families, particularly on communities of color, particularly on women, particularly on survivors. So we were really excited about the bill, which did two basic things. It limits no-cause evictions, and so basically it says if you have been in your home for at least a year, a landlord may no longer evict you unless you have done something wrong. And there are certain exceptions that were for sort of landlord good causes or just causes. For example, if a landlord wanted to move into the home, they're allowed to do that, but they have to give at least 90 days notice, and they have to provide some relocation assistance. And so that is sort of a basic protector of stability. The second thing that the bill did that was very important was limits how many times landlords can increase the rent each year. The cap on those rent increases, so gets rid of all of the, any increase over 10% in a year, or 10.3% in a year is no longer allowed. So we were excited about the law for those two reasons.
Wow, yeah, I think this is an issue that a lot of states and cities are really grappling with, and it's exciting that you were able to pass this bill. And so I think a lot of folks on this meeting today would be interested in knowing what the process was like of passing this rent stabilization bill and how the leadership of sexual and domestic violence agencies were helpful in this.
Great, and that was a sort of an overlap and a collaboration that was just so exciting to me. As a legal aid lawyer, have been so appreciative of the incredible work of the Oregon Coalition Against Domestic and Sexual Violence and our Sexual Assault Task Force and all of the local providers to survivors. And we work very closely with all of those organizations in helping our clients. And of course, housing is also very important to all of our clients in Oregon. And so seeing this coalition come together of housing advocates and survivor advocates was I think really powerful, and I think holds great potential. And the first step in that was that every year the sexual assault and domestic violence advocates and allies work together to create a priority list of the issues that are the most important to survivors and that need policy assistance. And we did that prior to the discussion of this bill, and what came up as just overwhelmingly the number one need expressed in every single county in our state by survivors, by advocates, and by the allies who work on domestic and sexual violence issues was housing stability. The lack of affordable housing, the lack of stability protections, and the barriers to accessing housing were just across the board number one need. And so that really caused us to, as survivor advocates, to think, who are the allies that we can reach out to and work with, and are there efforts that we can be a part of? So we were lucky to be able to plug into a group really of about 20 different organizations. SEIU and AFL-CIO were unions who were very interested in housing stability from their member perspective. They were invaluable in providing us with really great coalition and strategic campaign advocacy skills. We also worked with the communities of color, LGBTQIA community advocates, the tribes, child advocates, healthcare advocates, colleges, student unions at colleges were incredibly involved in the discussion. So there's a really broad-based network of folks that worked together to really create a thread of, they worked with us to help the survivor advocates share their stories of how housing instability really put people at risk. And that was built into the conversation all along the way. So I think one of the really important things that came up for us in the discussion, I think there's a couple of key issues that we really tried to hone in on, was helping legislators understand that the facts around housing instability and the impact on survivors. And so similar to what we heard earlier in the call today about employment instability, housing instability has incredibly negative consequences on individuals, including financial hardship, loss of community, increased stress, child distress, depression, and all sorts of dependency. Significantly also, job disruption was a major outcome of displacement due to eviction or extreme rent increases. And all of these things, as we know, really increase the vulnerability of families and increase dependence on potentially abusive partners. In Oregon, what we found was that women face significant rates of housing instability and are the most cost burdened in the state. And so bringing those facts to legislators really, I think, helped them see the housing crisis in a slightly different light. And where I think legislators were used to thinking of a housing discussion as really sort of a landlord versus tenant battle, the breadth of our coalition and the presentation of sort of survivor and prevention perspectives, I think helped broaden their understanding of the importance of a state response that would better protect stability.
That's really helpful. Thank you for sharing some of that research too on, what you were looking at locally. Taking some of that research, how did your coalition, really make these connections to decision makers and the public?
Well, we were really lucky. We have a great network of survivor advocates in Oregon from across the state, and people really showed up and were willing and able to share stories. And so we had advocates coming forward to share letters that had been written by survivors in their communities and share stories of what happens if you are in a home that is unsafe and you are trying to leave, but there is no place to go? And what is it that, what are the risks that you end up taking in order to try to protect yourselves when you are, we had people sharing testimony about ending up living in a car on the streets because of a rent increase notice that resulted in an eviction, and what risks came up as a result of that. And so just bringing those stories forward and really writing letters and coming to provide testimony and meeting with legislators was incredibly powerful and helped us really solidify some of our relationships both in the building, in the Capitol building, and then also with other advocates with whom I think we have great opportunity to continue working in the future on further housing issues, but also other areas where economic stability can really help benefit women and survivors.
Great, and maybe we should show the next slide too with some of those articles that you've started to talk about. Is there anything you want to say here about the different media?
I think we really found that press was excited to hear from us. It was sort of a new aspect on the housing crisis that many of the local press hadn't really considered, and so we found people were willing to give us space in the op-ed area, and we also managed to get a lot of letters to the editor published. And one thing I'll just point out, and this is in the materials, but we, in our survey that we sent out to all of, just circulated statewide, there were lots of quotes that people gave us about what the impact of housing insecurity had on survivors, and so many of those quotes ended up in the letters to the editor, in testimony, and they were incredibly compelling. So I'd encourage you guys to take a look at those if you could. I know we're running out of time, so I'll finish up by really just talking about a couple of key takeaways that we had. And one really was that I think our legislature and the committee, the sort of the community in Oregon as a whole, had gotten used to thinking about how important it was to prevent domestic and sexual violence, and they had never thought about that in the context of housing. And so I think that was a bright new way of looking at an issue that people found really compelling. I also think that the coalitions that we were able to bring together were really powerful and have really untold future potentials for us to work together. And I really think that the unions and other community organizations are starting to think about additional issues that may also have a prevention lens. So I'm excited about that. And I would really encourage folks who are interested in doing more work on housing to reach out to the National Low-Income Housing Coalition. They have a website, and they have a partner in every state. And in every state, those entities are working on housing stability, housing affordability, and housing preservation issues, and they would be delighted to have new partners. And so I'm happy to help provide any introductions if that's useful.
Thank you, Sybil. That's really great. And I think you've really clearly outlined some specific roles that sexual and domestic violence agencies were able to play in passing this and how their support was really useful in all of that. So that's really helpful for this audience. I also wanted to make note that Sybil was part of a PreventConnect podcast, and that's going to be coming out very shortly. So please do sign up for the PreventConnect mailing list if you aren't already on that, so that you can make sure that you can listen to that podcast. And the last thing I wanted to say here was just, Sybil, I really appreciate how you've been able to tie, housing to these issues, and also help us see how prevention and supports for survivors are really intertwined, and how housing stability is an area where maybe we can be thinking about it in a more integrated way between prevention, intervention, and survivor supports. So thank you very much for joining us.
So glad to be here. Thank you all.
So to close us off today, we just had Sybil share some of her key takeaways, and I just wanted to bring Alejandra and Jenya back and see if there's anything you want to share as we end off the web conference.
I think Jenny and I are sitting here also thinking of next steps and how to bring all of this together. Again, for me, is listen to the community, focus on risk and protective factors, especially raising the protective factors. The diverse relationships. Go to the community. Think about those who are in the field doing this work already, and partner with them, aligning on your efforts. We're also talking about, thank you so much for the feedback, we need to be more explicit when we talk about the chosen family, diverse relationships. It's very important. I think we talk about it so much, and we need to be more explicit and direct and make sure that it's on all of our materials.
Yeah, and I think the other thing, when I was talking a little bit about the pregnancy story, for me, that's also a caregiving story, and I also think that while there is a lot of research and really great research and emphasis on when a new children comes into the home, because that's a very joyous time but a stressful time, and it's really key for the health and well-being and development of children that there's healthy bonding relationships, we also know in the coalition really well that this is a benefit for caregivers, and that includes not just caring for somebody who just had a new child, but for elders, for people with serious health conditions and family members. And we would love to see a lot more emphasis on that, and maybe we even need to educate our partners who are doing the research on the new children that this is a whole family issue. It impacts the economic security, health, and well-being of a whole family. Many, many, many people in the coalition and people in the field have had the experience of the same year a new child comes into a family. There's a crisis where a family needs care. And the fact that your brother can be the one this time makes a huge difference to your well-being too. So that's how we really, is a growing kind of awareness in the coalition. And I think we do need a lot of help and input on how do we really make that explicit, that it is for new parents and caregivers and it impacts the whole family.
Thanks for those closing words and summary. Really appreciate having the two of you here as well. And I'd also like to bring Megan and Ashley back for just sharing some of the key messages from their research.
Yeah, so we just want to reiterate that paid parental leave provides benefits to all, and we talked about various ways that paid parental leave may lead to prevention and reduction in IPV and other forms of violence. There's also been evidence that has been building, but we do need some more research. And as many other of the presenters have mentioned, it's exciting and encouraging that even though we don't have a federal policy at this time, many cities and states have adopted paid leave policies, and many organizations have also decided to create or expand on their own policies.
Thank you for that. And they also have their email addresses here if you want to contact them for any more information. And we also have a bunch of, we did include the slides for download. There's a bunch of references and resources throughout the slides that you'll have access to. Megan, Ashley, do you want to say anything here about the acknowledgments?
Yeah, we just want to acknowledge our co-author, Dennis Reedy, and there's a link there to the technical packages. We have them on various forms of violence, including sexual violence and intimate partner violence.
Great, thanks. And again, the contact information for you. So to end us off, we do have more tools and resources to share with you. So again, in the beginning of the session, I mentioned how Prevention Institute, produced this economic security brief that talks through the pathways and includes examples. So please be sure to take a look at that if you get a chance. And we're really thankful to the Partnership to End Domestic Violence in California and the Work and Family Coalition for also being part of the process for writing that brief. We also have some resources from the National Resource Center on Domestic Violence focused specifically on housing. Ashley or Tori, do you want to say anything about these?
Yeah, I just want to, the National Resource Center on Domestic Violence is one of our national TA partners. And so these are some specific resources that we'd love to point to for additional learning and resource sharing. So there is a Safe Housing Partnerships website that you can check out, and then a report on helping survivors recover from economic abuse, and we'll put those links in the chat as well.
Awesome. And yeah, we do have many more resources here to share.
Sorry, I didn't realize it was broken up onto two sides, so there are the other ones.
Yeah.
We'll make sure we get all those links in the chat.
Yes, for sure. And I did also want to elevate that the California Health Report actually did a story or article on domestic violence prevention and economic security that Alejandra and I believe Jenya were both interviewed for, and I was also interviewed for it. So you can take a look at that link as well. And Oregon has a YouTube video if you want to learn more about SB 608 and lots of other things. So please be sure to look at the different resources if you're interested, and just want to, again, thank our guests for today. This is a great session. I'll let Ashley close us out.
Thanks, Alicia. Thank you all so much for joining us, for rolling with us through those first minutes. And thank you so much to our wonderful guests. This has been such a real learning experience for me, and I think probably many others, and I'm just grateful for folks who really engaged with us and shared about some of what you're seeing and the work that you're doing. So thank you as always. We did record this session, so we'll be putting that up on our website within a week or so. And as Alicia mentioned, we do have a two-part podcast being released tomorrow, actually, with Sybil to talk more about the work in Oregon. And so if you're not already on our mailing list, go ahead, head to our website, sign up, send me an email, I'll get you signed up, and that way you will have those podcasts in your inbox. So thank you all so much. We hope that you have a great rest of your Thursday, and we hope to see you on the next PreventConnect web conference. This ends our web conference for today. Take care.